Welcome to After the Bell. I am your host, Lauren Cranmer. I am a stage 3 breast cancer while pregnant survivor, and today we have a very special guest, and her name is Devon Fanelli. She is my physical therapist, and she is a specialist in lymphedema and breast cancer rehab. I wanted to bring her on because I want to talk about lymphedema more, but also she just oozes passion in regards to what she does, and she's so knowledgeable, and she really made such a huge difference in my journey and my experience with rehab and lymphedema, and just having really a quality caregiver. We need more people like Devon. And I am so excited to be able to offer this to you. We talk about all things lymphedema 101. We bust some myths, and we talk about prevention and what we can do. It's a really good episode. And I really hope you enjoy it. Share it if you know somebody who is at risk for lymphedema, who is going through breast cancer treatment. This information needs to get out there more. We need to not fear lymphedema, and we really need to give power to the patient, as Devon says. So please help me welcome Devon and enjoy this episode. Welcome, Devon. Thank you so much for being here.
Thank you for having me.
It's been a little while since we've seen each other in person, But Devon is my physical therapist. I went to her for all of my lymphedema needs, and thank God, because you are amazing.
Thank you. I am lucky to take care of the women I take care of.
So give us a little roundabout about your background, exactly, what you do first, and then we'll jump into questions. I asked some women questions if they had any for you, so we'll get to that at the end too.
Love that. Okay. So Lauren, as she said, was one of my amazing patients. And I feel like it's so awesome to work with the women I work with because I get to connect in the ways that I connected with you and everybody else that I work with. So it is pretty awesome to work with women every day, all day. So I am a physical therapist and I run the breast cancer rehab program at a Southern Ocean Medical Center. So like Lauren mentioned, I take care of anybody who's recovering from a diagnosis of breast cancer. My background is that I went to school, I got my doctorate in PT, and then I've always wanted to be an advocate for women in the healthcare field. I think there's not enough of us, and I think there's not enough focus on women's health, and that naturally led me down the path of breast cancer and oncology rehab. I started out really specializing in lymphedema, and then I kind of took that a little further because I felt like I was missing information and pieces of care. So after I got my doctorate and my certified lymphedema therapist certification, I went back and certified for oncology rehab and breast cancer rehab with an amazing group in Colorado, and they specialize in all individual parts of oncology care. So I think in a nutshell, the program that I run at Southern Ocean is one that's focused on managing any of the impairments and limitations that accompany surgeries or breast cancer related treatments. So it's a comprehensive program. And like you mentioned, a lot of times I'll end up getting people for lymphedema. And then we explore a lot of the other things that come along with an oncology diagnosis.
Amazing. Thank you for everything you do, because having that knowledge and background is so important for people who, you get thrown into a cancer diagnosis and you're in this new world of learning, and there's so much. And I think having specialists and people who really dive deep into their, their work is so vital for good patient care. So thank you for that.
Absolutely. Yeah.
So I have so many questions for you.
Yeah.
All things lymphedema, and I know lymphedema is a big concern after mastectomy, correct? Or is
it can be, yep. Mm-hmm.
It's mastectomy, but also mainly lymph node removal.
Correct.
So, but you can be at risk with mastectomy, or?
Yeah. So when I talk about lymphedema, I like to talk about it becomes the elephant in the room, lymphedema, because I think that often we avoid bringing up this topic, sometimes on the provider side and sometimes on the patient side, because there's a lot of unknowns and gray area about it. So when we talk about the lymphatic system is one of our body's most amazing systems. It's like a big recycling center. It's responsible for picking up all the things that you don't need. So cellular debris, meaning dead cells, bacteria, viruses. It's got such incredible parts of it that are incremental in helping you recover from infections or disease. It's what catches a cancer diagnosis first. And so our system is all through the body, but it's extremely efficient. So when there is a surgery or a treatment, some surgeries and some treatments can hold a little bit more value in terms of how they affect the system. So I like to say the big three that affect it are really anything where you're intervening in the lymphatic system. So we've got the lymphatic system all through our body, but when we go through a breast cancer surgery or treatment, the lymph nodes that they're primarily going after are underneath of our armpit, right? And sometimes there's 1 or 2 of them taken, sometimes there's 10 or 15 taken. The truth is that any little bit of intervention to the lymphatic system can cause the efficiency of that system to come down. So it still works incredibly well, but it just works a little bit less efficiently to remove fluid. And its job is to put out fluid with all of those great cells to help you heal. But the balance of that system is what starts to become affected. And depending on what treatment you have, that makes it harder or easier and a higher or lower risk for you to experience a swelling. So intervention to the lymphatic system surgically, so lymph node removal, dissection. The larger the surgery, generally, the more lymph nodes removed and the greater amount of inflammation that might be created in the area, right? So there's generally just a slight increase in risk with a mastectomy versus a lumpectomy. And we don't have a number of lymph nodes that we believe to be responsible for a high risk of lymphedema, but truly, we believe the more lymph nodes that are removed, the higher the chance could be that there's more swelling. And then if there is disease in those lymph nodes, sometimes that can also cause a risk to be higher. The second treatment that is very responsible for causing stress to the lymphatic system is radiation. Right. And radiation is something that can sometimes, again, stoke up that inflammatory response. And so there's more fluid being put out, which is totally normal because your body is trying to heal you. But it lowers that efficiency of the system. So it's harder for your body to kick that fluid out. And sometimes that fluid can hang out in the area, not always as a lymphedema, but it can cause some what we call stasis or fluid stasis, fluid remaining in the region. And the longer it sits there, the higher the risk. Not moving as much after a surgery or a treatment can sometimes contribute to increased risk. And then certain chemotherapies can also contribute to that risk. A little bit less on the percentage as radiation and node removal, but things like Taxol, Taxotere, and certain immunotherapies can contribute, again, to that stress to the lymphatic system. But really important to remember that your lymphatic system is always working and it's an incredibly resilient system. It's just that efficiency part of it.
Right. I remember I love the way you explain things, by the way, but I'll never forget like how you described like kind of like the jellyfish.
Yes.
the way it moves, like kind of how it moves through your body. That's something I always think about when I think about my arm and my lymphatic.
I love that you remember that. That's incredible.
No, I'll never forget the bye-byes too. Like I'm a bye-bye girl. Like
yes, bye-bye all day, every day. I show everybody the bye-bye. Actually, I can show everybody on the podcast bye-bye. So kind of right, what you're referring to is that your system, your lymphatic system is much like your vascular system. So it's a big system. It runs continuous with your veins and your arteries, but it is very responsive to pressure, right? So your lymphatic system kind of works like this jellyfish that moves along and kind of pumps, and it works against gravity. So it needs some pressure and some energy to do so. And so if there is a lot of fluid sitting in an area, maybe because of node removal, maybe because of a surgery, maybe just because you haven't been able to move as much. So that system then is going to have to work a little harder to get that fluid out of there. But the lymphatic fluid that you have has protein molecules in it. And this is important because that's what does the work of the system. But these protein molecules, they love water. And so they get bigger and bigger and bigger and bigger as they sit. And now that jellyfish is real big and it can't push out of that system osmotically or passively, right? And so that's where some of the interventions and exercises come in. The bye-bye is one that Lauren's referring to that helps to pump that system along. And our muscles help to do that because the lymphatic system is very superficial. It's right underneath of the skin. You could touch it. And so if we use muscle contraction or exercises, that helps to push those jellyfish back through with a pressure that then kind of recovers some of that efficiency.
Now that we covered exactly kind of like what lymphedema is, and how it's caused, is it preventable like 100%, or is it always at risk if you have one of these, 3 factors going on or all? Or
Yeah, that's a great question and probably one of the biggest questions I get asked by patients. So I think what's important to know is that anytime that you have a surgery, a radiation, a lymph node removal, sometimes even if you go in for a lymph node biopsy prior to surgery in the armpit region, we can develop some swelling. What's important to know is that this is normal, right? Our body's job is to put swelling out to try to protect us, and eventually it kicks it out, right? So there is always going to be some presence of fluid during these procedures in recovery. And what's important to know is that it stays stable and that it eventually starts to kick out. When we are dealing with a clinical lymphedema, we are dealing with fluid that has been there for some time, maybe is a little bit less variable. It's not moving as easy. The longer it sits in there and the longer it goes unmanaged, the more challenging it can be to get out of there and the higher the risk that a clinical lymphedema develops. So I think what I like to educate to patients too is that I don't like fear to be created around lymphedema or swelling, because this is your body's way of healing, right? Mm-hmm. This amazing system is just working to get things out of there. So I think the risk for that lymphedema is always present. Ways that we can prevent it. So being educated about what exactly happens when you might be getting a swelling that's nefarious or maybe causing a problem, right? Mm-hmm. So, for example, when your body puts out swelling, you might not always see it. It might not be always so obvious, right? So I think I remember you kind of saying to me, if I remember correctly, and my memory is going a little bit sometimes for the past couple of months, but because I think that one thing that my patients will say is, I feel like my arm or my chest or my breast, I feel that it feels heavy or tight or numb, right? I think I remember you feeling that way,
like
right?
The heaviness.
The heaviness.
Yeah.
So your system is going to warn you in some capacity that, hey, I'm having a bit of a hard time recovering here, and I need a little bit of levity. And what that means is you want to be aware of what those symptoms feel like, because if they increase, it may be a signal that your lymphatic system is struggling a bit, and it may continue to do so. Another sign to look out for are things like differences in how your hands might look. How does this hand look with the bones and the muscles and the tendons versus this one? Oh, this one looks a little cloudy, or it doesn't look as clear. That could be a sign. But it might not even be that obvious. It might just be that the arm feels tired when you use it a lot. So women being able to self-identify what it feels like when they have swelling and also when it improves is one of the biggest prevention strategies. When you are going through treatments like radiation or recovering from a surgery, making sure that the skin is taken care of, making sure that if you get a cut, a bump, a bruise on that side, that you're managing it pretty quickly. Whereas, otherwise we might pick at a scab, or we might not take care of our skin as well. So being more preventative and managing it that way. And movement is one of the biggest things that is helpful. We used to have these misnomers that we would tell women, don't move, don't carry, don't lift, don't do anything, there's this fragility behind the lymphatic system. And the truth is there's not, as long as you are paying attention to the way that you feel, right? And that's incredibly autonomous and empowering for women, because you can help to prevent it. But I think what's important to note is that we don't have a great predictive value for who may or may not experience different severities of this type of swelling. And so it's possible that you do all of these things and there's still a little bit of swelling that gets in there. And that's where we come in to help you. So there's no fault of anybody, even if you don't notice it. But there is that piece of it where if we're preventative that way, it can be really helpful. Obviously, the use of things like compression garments with flying, I can talk about that a little bit if you'd like me to. But those are some other strategies that we use.
Now, correct me if I'm wrong. I remember you also saying it's more so like, it's not like if you got a cut on your arm, you'd get lymphedema right away. It's like these little like small injuries over time.
Yes.
That like, it's like this like slow creep more so.
Yeah. Yep. Yeah. So something I like to explain too, if anybody thinks about like the lady with the scales, right? She like has the two scales here, and the lymphatic system is pretty accurate to this actually. So on one side you have the swelling being put out, and on the other side you have the swelling being picked up. So you always want to maintain this balance of the lady with the scales. Now, when you go through an oncology diagnosis, radiation, lymph node removal, surgery, that balances off a little bit, and it will always stay that way. That decrease in efficiency doesn't change, but that efficiency can shift on either direction depending on how you manage things, right? So more incremental injury to the lymphatic system, it ticks up that swelling that might be put out and stay there for a little bit more than the efficiency of the ability for it to be removed. So it's absolutely correct. It's usually not this big event that occurs.
Right.
It's often over time. Things like needle sticks, blood pressure taking on the side of involvement, we say go to the side of least involvement. If you have two sides that are involved, then go to the side that had the least amount of lymph nodes taken for blood work or blood pressure, and monitor yourself. Maybe it doesn't affect it, but we don't really want to try the lymphatic system in a way where it's given the opportunity to have some trouble.
Right. Absolutely. Now, when you said it ticks the scale, you can tick it back, right? So like
You can.
if you're like kind of leaning it really hard,
Yeah.
you can work to get it back down and level it.
100%.
Okay.
So there are two versions of lymphedema. And without getting too crazy clinical, this is also a way that we can give some confidence to women about the ability to have some reversibility of the system. When a lymphatic system is changing a lot, meaning your swelling is varying, right? It might get worse one day, but then it looks a lot better. This is a good sign, even if there's fluid in there, because that means that your system is active and it's doing its job to, it's having a harder time for a little bit, but then it's getting better. So when there is this fluctuation of fluid where it does change from worse to better, that means that there's still a lot of capacity for the system to recover, and sometimes close to the point where you won't notice it. Important to note that there's always going to be some aspect of difference post-diagnosis surgery treatment to pre. But what we focus on in lymphedema care and breast oncology care is that those changes are stable and that they do not affect quality of life and function. So the more regularly you're aware of the symptoms and how your body feels, and knowing, I just went to go lift a bunch of grocery bags out of the car because I just don't want to take multiple trips. And I now notice my arm feels really heavy. I'm not going to do that again for a little bit. Let me just see if my arm feels better. Oh, it feels completely back to baseline. You're good. So sometimes it's small things like that. And sometimes it's over time, we kind of work in a rehab setting to reduce it. But there is certainly some reversibility. The more extreme swelling where it sits there for a bit of a longer time, it's not managed as quickly, or you have more intensive treatments that might affect the system, or it's just an unlucky situation, then there can be an issue with reversibility, but there is always something we can do to make it better.
So to me, that sounds like learn to be self-aware, aware of your body. And also once you do experience, a situation where you are having this increased swelling, like if you can contact a person like you yourself and get help.
Yes. And early identification is important. I think another thing that women don't realize is that swelling can also occur in the breast. So even if you've had a mastectomy, you can still have swelling there, and you can have it along the trunk. So something I love to explain is that the lymphatic system is split into quadrants, right? So it's split into the right side, upper body, so your shoulder and back, breast and trunk. Same thing on the left. And then your lower body, right lower leg, abdomen, same thing on the left. And so what's amazing about the lymphatic system is these areas are contained. So any effect that occurs on the side of involvement will not affect any other area. And secondly, we want to look out for these symptoms and signs, not just in the arm or in the shoulder, but how does the post-surgical area feel? Even if it's distorted in sensation, does it feel like something feels off? Does it feel heavy? Does it feel tight? Our lymphatic system is all through our body. So things like diaphragmatic breathing, something as simple as diaphragmatic breathing, helps to allow the central drainage of our lymphatic system to improve. So even something as nuanced as that can help posturing, right? One of the biggest things that I think that I give as a resource to women who come in to see me is when you go through radiation or surgery or any of those things, your body will try to protect you. So without you knowing, your body may do this, right? Because it says, what just happened? I'm going to try to protect myself. But in doing so, we limit the space and the movement of the lymphatic system through the chest, through the highway of the armpit. And so being able to be aware of positioning, using things around your house like a pillow to put between the arm and the body upon recovery, positioning in bed, positioning in a chair, gentle shoulder blade squeezing, and being aware of how that posturing well, first it'll feel great. And then secondly, it helps to allow that lymphatic system to work again more efficiently because
More
it's a
space.
physical limitation. Yeah.
Yeah. Now, I know a lot of women do have like the actual range of motion issue post
Mhm.
mastectomy, right? Now, does
Mhm.
that makes them more at risk too then for that reason, right?
Absolutely. So lack of movement or positional guarding, we know contributes to increased risk of swelling to be present for a longer period of time and maybe in larger amounts. And the reason for this is because the lymphatic system is just like the rest of the systems in our body. It needs to have the adequate movement and space to be able to flow appropriately, right?
Right.
So it needs a pressure at rest that's strong enough to push the fluid along, and it kind of goes centrally. That's where it drains. So if you have a position where you're not moving and you're guarded, right? Or maybe you're only getting to shoulder height, this doesn't allow a lot of movement through the major highway of where the lymphatics run. So we know in evidence with physical therapy, the more movement we have through these regions, the more efficiently those vessels can move. Muscles like our pectoralis muscle kind of sits like a big hand across the chest. In most surgeries, even mastectomies, those tissues are not debrided completely out. They're not removed completely. So they can tighten. And that muscle that's right across the chest, but also to the shoulder, is responsible for keeping your shoulder in and going overhead. So if that muscle is tight, it's going to compress along the area of where the lymphatics run, which is right underneath of it. And it's going to make it harder for them to recover, right? So then that efficiency comes down a little bit more.
Right.
So early movement, early mobilization, early understanding of how to position and posture is huge in the recovery of lymphatics and may prevent someone from getting it who might have been at a higher risk to have it.
Now, is there any relationship to lymphedema and cording?
Yes.
Okay.
Good. Excellent question. So we believe that, so for those of you who are watching who don't know what cording is, cording can be present in any area of a post-surgical patient. We often find it with patients who have had lymph nodes removed, usually in a little bit of a higher amount, or patients who might have had a harder time recovering. So those are things that contribute to lymphedema too and to swelling being present. Presence of things like seromas or infections or hematomas, like the bruising that you get on the skin. And what happens is cording is what we believe a lymphovascular injury. So it's resultant of just, again, intervention to the lymphatic system, lymph node removal, and it looks like little strings. So you may see them. Often we see them in the armpit area, but they can go down the arm. They can go down into the forearm, and what that is usually a warning sign of is that your lymphatic system is struggling. Now, not everybody who has a precursor or a pre-stage to lymphedema will experience axillary cording, but it is generally understood to be that your lymphatic system is a couple of steps away from not being able to get fluid out as easily and maybe developing a lymphedema. So women will often tell me they feel like that there's a string in my armpit, or some women will say, I see a string here. And a lot of times women are like, am I imagining this? And the answer is no. And it can be pretty common. Decreased movement of the arm and guarding immediately after surgery or a treatment can also contribute to this because it has to do with fluids sitting in the area,
Right.
and those tissues don't know what to do and they just kind of wrangle themselves together, and it can be painful.
Yeah.
So that is definitely like a bit of a warning sign and a precursor to things.
Okay. And you would treat you're treating them very similarly when when you have cording and or lymphedema, or am I
Yeah. Yeah. So when we have someone who comes in and I identify cording,
Mhm.
it's an immediate flag to me that their lymphatic system might not be recovering as well as we want it to be.
Right.
And so the sooner we get at these cords, the easier their time is going to be recovering with the lymphatic system and with movement, because it's impairing to both movement and
Right.
the lymphatic
Okay.
system. So whenever I have a patient who I see that with, I am going to use manual techniques that are going to address decompressive therapy. So swelling, getting swelling out of an area, moving the body, stretching the body in different ways and protocols that help to make it a little bit easier to move, and then promoting movement through exercise after. So it's kind of like, if a patient comes in, we might use more specific manual techniques that address breaking apart those cords.
Mhm.
And so the bye-bye is a really awesome way of doing that, because when you move certain ways and stretch the lymphatic system and the nerves and all of the things that are involved, those cords will likely break apart. And sometimes people feel them. I always say, when you're doing the exercises that I give you that are aimed at breaking these cords, you don't want to aim for a big pop, but if you get one, that's okay.
Oh, wow. You actually can feel a pop?
You can feel it sometimes.
Oh,
Sometimes my
wow.
patients will say to me, I felt a big pop, and they get very excited. And then we don't want to aim for it to be too aggressive, because then the lymphatic system can get overwhelmed. But we do very specific manual techniques and stretching to try to break apart those things. But generally they get better. And we start to see them less down the arm and less up into the armpit. And eventually they're almost not visible or feelable by the person.
Now, would you say if you see it from the armpit versus like further down, like it's more aggressive if it is further down, or does that matter? Oh, it is. Okay.
So the more extensive we see those cords or feel those cords.
Okay.
So the more we see cording down the arm or in the breast or along the side, the further it is away from the armpit, this generally indicates a little bit more severity. Okay. So if someone can feel them but not see them, then that's a little bit of a less severe sign. But if someone can feel them and see them, then we know that there might be a little bit more stress to the lymphatic system.
Okay. Interesting. That's so interesting to me. Now, when you were talking about like the manual technique, now I remember it being fairly gentle. Like, is it a lot of gentle movement because it is so close to the surface?
Absolutely. So when we do lymphatic therapy, there are a couple of different schools of thought. So every therapist kind of has their different way of doing it. But part of what we want to watch out for is with the lymphatics, it's so superficial. So if you gently just do a little stretch of your skin, you're stretching the lymphatic system because it's right there. It's wild. It's right there. But if you press down too hard on it, or you're doing really intensive massage, that can actually be counterproductive.
Interesting.
And that's something that I find that women don't know about, because I think that is a system that not as many providers focus on. And so we think, because it feels, sometimes it's like a good hurt. Patients will, I've been digging into that cord and like, I'm trying to get rid of it. And that may feel good in the moment, but because it involves the lymphatic system, we have to kind of work from the bottom up, right? So the lymphatic system drains from the furthest point all the way to the center. So we always want to promote light movement of the skin, because that's how we know that we're getting the lymphatic system to push fluid out, which then will recover the stress that might be on those cords. So that's the first part of the manual therapy. Sometimes I will go after those cords a little bit with different techniques that are techniques that I know that can be tolerable, that are safe. And then after we do that, the idea is that the system has been primed a little bit and we can move through range a little bit easier. So what I find is when I do those lymphatic techniques and then I have a patient stretch, they are able to get a little bit further. And so I also teach people the self-manual massage. I also teach them stretches that are going to help them autonomously be able to do this, because it has to be something that is over time. And it's something that, it is a little gradual, which can be a little bit frustrating, because we would love for that to go away right away. But
it has to be like a consistent thing. And I think too, a lot of women talk about they're like doing lymphatic massage themselves, obviously, because they have to. But I know for me, like I almost feel like I'm not doing enough because it's being gentle. So like I sometimes, even before I went to you, like I was definitely way too aggressive when I was trying to perform my own lymphatic massage like on my arm. But it's like sometimes you just have to really just like tone it down a little bit in terms of that massage, right? Like you have to just be very gentle on your arm.
Yeah, another good example to think about is another way I like to explain the lymphatic system that sometimes helps to make this make sense. When we teach self-lymphatic massage, we want to think about what is it exactly that we should be doing? Am I just sliding up my arm? And the answer is no. So we want to think the lymphatic system, like we said earlier, it works against gravity. And it has these little pieces of active cells in it, in the middle of them. They look like, under a microscope, they actually look like Pac-Man. So it looks like a little Pac-Man that sits and his mouth opens and closes against gravity to push this fluid kind of up. It's called the lymphangion. And so this is the contractile portion of the lymphatic system. So it pumps up, releases fluid, closes. Sometimes in lymphedema, as it relates to breast cancer patients, that lymphangion, that Pac-Man, can be a little lazy and his mouth is open a little bit, and then we're getting a little bit of backflow.
Got it.
And like we said, fluid has protein in it, and sometimes it can get bigger. Those cells can get bigger because the fluid sits in them. So when I teach lymphatic massage, it's superficial, right? It's really light, but you want to have a little bit of a pump or a circle because you're trying to say to that Pac-Man, hey, open your mouth up, but also close it. And you're working from the outside all the way to the chest. And that promotes the natural pressure and the movement of the lymphatic system to even more efficiently get fluid out of there. And that's what you're doing when you're doing exercise.
Yeah.
The same thing. The muscles pump against the lymphatic system because it's so close that it helps to move everything away. So that's where that misconception has kind of been crushed, is that we want to use movement and muscle contraction to kind of engage our lymphatic system the way that it normally would if it didn't have an efficiency issue.
Absolutely. Now, what would you say is the best form of exercise in terms of lymphedema, like trying to like help support that movement?
That is a question.
I'm sure it is.
That is a question. So certainly I like to start my patients with things that are local to the area, right? So the biggest and most important exercise that I will give patients, and I kind of said it before, is the postural exercises. If your body is guarded and restricted, this is the center of where everything happens. So the biggest thing I can tell patients to start with is thinking about how your body looks and feels to you. How's your rib cage moving, right? Our rib cage has 45 degrees of expansion, right? But if we're guarded, you're not getting any of that. Right. So working on diaphragmatic breathing, working on trunk positioning. I know everybody, when I say that, it's like, right? So working on getting that positioning of your trunk upright, because then you maximize the ability for your lymphatic system to flow. So once we kind of have that under control, then we want to go to the extremities, right? So being able to move your arm as much overhead, right? So this is the example of the bye-bye exercise. We start with our arm straight and we're moving that hand back and forth because that stretches all of the structures that are underneath of the armpit there. And then working on strengthening, right, of the upper back, because again, we're talking about a scale here. If you're tight in the front and you're weak in the back, then even trying to get away from that positioning is going to be really hard. So focusing on strengthening of the upper back. So with patients, I'll be working on things like rows and pull downs and strengthening our muscles like our serratus and our lat muscles in the back, and also stretching this area. So again, stretching our pectoralis region, moving our trunk and rotational planes so that we don't have stiffness through the body here. And then another big push for lymphedema and just in general for recovery of the lymphatic system is aerobic activity, right? So making sure that we're walking, that we're moving our arms naturally, that we are getting our heart rate to safe ranges. Those are things that I like people to be very cautious about, especially if you're in active treatment, because different chemotherapies, different drugs, different surgeries, different tolerances of all of those things, those can create a little bit of an unsafe space for pushing your body aerobically. So that's something in physical therapy that I take a look at too. We have amazing tests and protocols that help to establish that type of aerobic conditioning. So I can talk about that if you want me to. But movement and getting your cardiovascular system going is really important. And an important fact that I always like to throw out, I throw it to physicians and patients and everybody, is that deconditioning or loss of that kind of ability to move around is the biggest risk for mortality and oncology diagnosis, the biggest risk. So I like to focus on that. Obviously, I'm biased because I'm a PT, but we have to be able to move because all of our systems are not working well.
Yeah, absolutely. And now when I have so many questions about that too, but a lot of women go straight to rebounding when they want to deal with lymphedema. I know it's like a big thing. I don't know if there's
like
like trampoline.
Okay.
Like soft, like the gentle jumping, I guess you would call it. Is that like, is there any validity to that?
I have not read any valid or reliable articles that correlate true improvement in the lymphatics with that. I think in an intact lymphatic system, when you don't have any efficiency issue, that might help the recovery in things like the legs or the abdomen because you're getting a little bit more pressure going through the area. But in a system that has less efficiency, so someone who has a lymphatic impairment related to, again, an oncology surgery or diagnosis and treatment, we don't see a huge correlation between those two things. I don't like to postulate unless I've read the evidence behind it, but if I were to guess, I think it's just that you already are lacking the pressure that naturally needs to be there at rest to get that swelling out of the area if it is there. So sometimes the rebounding is just, it's not going to have an effect because there's already a lack of efficiency there.
Okay. And so you would say like not running, but cardio or aerobic activity is better than strength training in regards to lymphedema?
I would say both are equally important.
Okay.
Both are equally important. Yeah, because when we think about those two types of exercise, we want to think about what are the aims of them, right?
Mm-hmm.
Aerobic exercise is working on cardiovascular health, right? So that means getting our heart rate up a little bit, getting our ability to tolerate things using the lungs and the heart at a harder amount for a little bit longer time, working on that conditioning. That's going to help all of your systems, your vascular system, arterial system, return of blood, return of lymphatic fluid. But it's going to do it in a very whole body way, right? Strength training, resistance training is going to do that in a whole body way. But if you're focusing it in the area of where there's an impairment with the lymphatics, we have to remember, again, back to that example, our muscles are right on top of and underneath of our lymphatic system. So when you're working on strength training, you're working on that hypertrophy, right? Time under tension.
Yeah.
You're working on contracting those muscles, which then pushes that fluid and works on that contractile part of the lymphatic system. So both are beneficial, but for different reasons.
Mm-hmm.
The most important part of it is that it is tolerable and that it is at a rate of perceived exertion that is safe.
Right.
So those are the things that physical therapy helps to establish. And that's not just for the lymphatic system, but it's also in relation to how your body may have tolerated or may tolerate future treatments.
Amazing.
All of this stuff is so important because it gives the power back to the patient, right?
Yes.
Like this is stuff that once you have the education and the knowledge and the framework for it, and you know how to do it safely and you're guided under a breast cancer rehab PT, this is stuff that you can take into your hands, right? This is not something that I always say that cancer can take from you. You can always move and that can always help you, but
Absolutely.
we just have to do it safely.
Yeah. I think the best thing that I started doing more so of was more like aerobic activity. And, you know, I try to do both aerobic and obviously strength training for multiple reasons. But I feel like once I started to really ramp up my, you know, my cardio, I feel like my arm personally benefited from it greatly. I didn't struggle with like immense lymphedema or any like, I guess a clinical staging of lymphedema. But I don't know. I just felt like I didn't struggle with the things I was struggling with previously after, you know, I've met with you. So it's wild.
I think I have to give you incredible kudos. I think you are someone who is so incredibly self-aware of your body, how it feels, how it recovers, how it doesn't feel good. And that you deserve the credit for that because that is something that you listened to your body and you said, this feels really good for me. And that's an important point to point out is that your body feels awesome with that aerobic activity. I don't think anybody's body is going to feel bad with aerobic activity as long as you're doing it safely. Because it is always going to increase. It's going to increase recovery of all the systems. It's going to increase endorphins. It's going to help with pain relief. But you knew that, God, when I do this, I just feel so much better. And that's what you stick with, right? Like you're saying, you're doing the resistance training, but everybody's body is very different. I always like to point that out too, is that you could have the same diagnosis, treatment, surgery, removal of lymph nodes. Everything could be the same. Age, medical history, all of it can be the same. And your experiences between two people could be very, very different.
It's wild.
And so that self-awareness is incredibly important. And the fact that you do that is just like amazing.
Well, thank you. Thank you. Yes. No, I mean, I want to do the best to feel the best I can, you know, so I try to pay attention as much as I possibly can.
Yes, but you do. You're incredible.
But yeah, I actually remember one time where I think I was like in the car and I reached back to my kids and I felt that like, it was like that heaviness or something, like it was just not right. And I remember, I think I even spoke to you about it back then, but like that,
I think I remember you talking about reaching back in the car.
It was such like a weird thing. Cause I'm like, I just reached back. Like I didn't do anything crazy. I didn't do anything like strenuous, but I felt it. So it was just something to be, you know, it's something as little as that, I feel, is what you're saying. Like that you just have to be aware that like maybe now it's time to pay a little bit more attention. And is that a time to, you know, we never actually touched on the compression garments. Now, when you do feel that way, I would imagine that would be the time to wear a compression garment or when should you always be wearing one? I know that's a question for a lot of women.
Yeah, absolutely. So I think I think one thing that I may answer this in a number of different ways, but I think what you're saying really rings true is that a lot of women don't know that there is maybe a potential issue or something that they're feeling until they do feel it. And it's not always going to be very specific until it is, right? So one of the biggest things that I think patients say to me is, I wish I knew this before, right? And I feel like a lot of women say that about the PT part of things, because there's so much thrown at women when they first get diagnosed. And to internalize all of that, and then to understand what you may or may not experience, and then to be like, what did somebody say? Did they say that I might experience? Like, how do I figure out whether or not I'm having swelling? There's so much fear and unknown around the side effects and the limitations that come with these treatments, that being able to be educated and understanding this before that occurs in a way that's not in your oncology appointment where you're talking about all the treatments and staging is really important. So that's where this type of PT and this type of education, even if it's once or twice at the beginning of a diagnosis, can help establish that resource. So when and if you were to experience something like that, the first thing I would say is, hopefully you've seen me or someone like me for an evaluation and you say, I'm going to call them, email them. Lauren knows you can call me, email me, do whatever you need to do to get a hold of me. I will get you in. And so will any of your other therapists who treat this. And we're all a little bit similar in that way. But the second that you feel something like that is the second that you want to start taking care of it, right? So when we talk about the first initial stages of management, right, we're going to go to a PT, you get evaluated, we manage the manual therapy part of it, the stretching, the exercise. When we talk about compression garments are, there's a couple of different types. So there are day compression garments, which are a sleeve or a glove or both. They're a pretty thin material. They are compressive. They're a little tight, but they are made in a way to support people who are experiencing a clinical lymphedema or an inefficiency of their system related to a cancer treatment. So they're made very specifically. So what I always tell women is, be careful about buying these off the shelf or in CVS or something like that. You want to have guidance by a medical provider or a PT to purchase them, because if you get garments that are made in a way that are not supportive of these impairments, it can actually cause a problem on the other side of it, because it can cut off the circulation and not have pressure in a way that's uniform. So when you have a day compression garment, the purpose of that garment is to brace your lymphatic system. And so it establishes the pressure that it's lacking because of the issues that it's had to it, and it keeps that pressure stable. It prevents swelling from getting worse if you are experiencing it. And some garments can also help to relieve some swelling while it's on, especially if you're exercising and moving. And the reason is because when you exercise and move, it increases the effect of that garment, right? It increases the pressure in a positive way. So compression garments are really helpful to support patients who have swelling, or they might just feel uncomfortable. Like they might feel like that heaviness or that tightness is bothersome to them in a quality of life manner. So we recommend the use of compression garments, day compression garments, for anyone who's experiencing an active swelling or anyone who might have a risk of that occurring. And so the recommendation for wearing those garments can be a little bit fluid. There is no evidence that says if you wear a compression garment 24/7, 7 days a week, that you'll never get swelling ever again and it'll go away forever. I think we used to kind of push patients into being really intensive about the way they use compression, but we have to remember that we're dealing with human beings and that human beings are going to have things happen unexpectedly, and that the systems are never going to be perfect. And I think compression garments are best described as a brace that you use when you feel like your swelling is worse. So maybe for you at that time, if you felt like, you know, you were just really active and you were using that arm a lot and the kiddos had a lot going on, it was a busy season, maybe in the times that you're in the car, you're lifting or moving them around, you say, you know what, I really feel like I get those symptoms of swelling. Maybe it's not actual swelling, but it feels heavy and kind of tight and tired. I'm going to put my compression garment on because it's going to comfort the system and it's going to prevent anything nefarious from occurring. But someone else might say, I don't really feel it unless it's really hot outside and I'm sweating and I'm dehydrated and I'm not able to control that as well. Maybe they put the compression garment on there. So everybody is very different. The important part is that you use it in periods of time where you might experience more of a stress to the system. The time that we recommend not wearing a day compression garment is in the evening, because when you go to sleep, that garment is not built to be as dynamic when the body is not in movement. And so if you fall asleep and you're in a nap or something like that, totally fine. But we don't want you sleeping in that garment because it could create a situation where it holds on to things. So things like blood clots and, infections, stuff like that. Nighttime garments are garments that are more clinically focused on patients who have larger amounts of swelling.
Right.
So if we have patients who are in that less reversible stage of swelling, we are going to use more intensive types of compression garments in the evening because those are meant to emulate some of the compression bandaging that we use in physical therapy for that more severe swelling. The other area that you would use a compression garment would be if you're traveling on a plane. So I like to explain this in the fact that when we go on a plane, even if you've never had an issue with swelling, if you sit for long enough, there's going to be some pooling of swelling somewhere because we're not moving and you're up, I don't know how high, but very high. And even though the cabin is pressurized in a plane, the lymphatic system gets a little stressed. Yeah. So when you already have an efficiency issue in the lymphatic system, we use this brace, right? This compression garment to help say, okay, there's probably going to be something funky that happens and we're going to keep the compression nice and stable and the lymphatic system nice and supported so that nothing can occur that, might if you didn't have it on. So what we recommend via what we call the National Lymphedema Network and some of the evidence that we use to support this is when you get on a plane, if you have the compression garment on, you wear it for the length of the flight and then half the length of the flight once your feet hit the ground. So if you're going to Florida, we'll round up, it's 3 hours. You land, you wear it for an hour and a half, you take it off, you do the same thing on the way home. Other areas where you might use it, areas of high altitude, right? Because high altitude can stress the lymphatic system out as well. So if you feel like that's something where you notice those symptoms, again, that self-awareness coming in, put it on. It can never really be harmful as long as it's not. As long as you don't notice anything uncomfortable occurring and it's fit well and you're measured for it or you have an actual clinical compression garment, it can really only be helpful. But the wearing schedule of it really depends on the person, so that it can be variable.
I'm so glad you said that because I feel like if someone doesn't go to, a physical therapist or somebody who specializes, they might not be told this information. And I've heard that before where they're like, I didn't know I should be wearing a compression sleeve on a flight. And I feel like that's like very important information to have for someone who has that risk. And also when you were talking about like when to wear it, I think a lot of women want to wear it as like a preventative measure.
Absolutely.
But would it be better to say that it's more of like a support versus a preventative measure? Like obviously you're not, you're using it to try to prevent it from getting worse. But in terms of getting lymphedema at all, like it's more supportive to like just help your body work better versus just preventing lymphedema.
Absolutely correct. So the biggest things to prevent lymphedema are going to be all the things that we spoke about, right? Understanding how your body feels, what those symptoms are like, modifying activities, keeping active, meeting with a therapist, all of those things. A compression garment is something that really is meant to be a brace of the system, right? But sometimes if we use a brace too much, then we don't understand the variability of that system, right? So an example I like to give is if you have a knee, right, that dislocates, or you have a patella or your kneecap, you feel like there's some instability there. We've all kind of experienced those sports injuries or things where we're like, oh man, every time I do this, I just feel like my knee feels strange, and you have a knee brace and you say, all right, I'm going to do something that I know is going to cause that feeling again. So I'm going to wear my knee brace. But if you wear that knee brace all the time, every single day, every single hour as a preventative strategy, we start to lack the understanding of how that is going, right? So if we don't understand what's making that worse, is it getting better? Is it still at the same severity level? There's no evidence to say that wearing a knee brace is going to make that any better in the long run. It's just going to prevent something bad from occurring at that time. The compression garment kind of acts the same way. It can be used as an exercise or an intervention, right? If we're using the garment and we're doing exercises very specific to the area where you have the swelling, and that goes for a breast, it goes for an arm, anything, then it's a little bit different. But there is no evidence to say that wearing a compression garment for longer amounts of time prevents swelling. It is really an actionable item.
I mean, because we want to be safe. We want to prevent it if we can, right? But sometimes we could be doing more harm than good. Also, real quick, being hydrated, that's very important, correct?
It is. So If your lymphatic system is under duress because you're very dehydrated, i.e., sometimes in the summertime when we are not getting enough fluids in, it's very hot, right? So our outside environment, things out of our control, are causing our lymphatic system to have to work harder. Then there is, in theory, there's actually not a ton of evidence to connect these two things, but there is some, enough for me to pay attention to it. And we have to use logic of medicine too. That if our lymphatic system that relies on circulating fluid around is stressed because of outside factors like lack of hydration or heat or just stress to the system in general, there is a risk that the lymphatic system could have a harder time in areas where it's less efficient. Now, the flip side of that is that a lot of patients say, even I've had oncologists recommend this, and it makes me cringe every time it happens, but oncologists will sometimes recommend a diuretic or a water pill or even blood pressure pills. And so, without getting all fired up on a TED Talk pedestal here, that is not going to do anything for the lymphatic system because we are dealing with a very specific impairment that is caused by very specific treatments. So hydration and keeping your system in a very healthy state, yes, absolutely, that is going to be helpful. But water pills and things like that, even things like having the arm elevated, is not really going to do a lot because we have to remember those molecules of our lymphatic fluid are filled with protein. They get big and they're stuck. So maybe you notice a small difference if you elevate the arm, but it's going to go right back down unless we're acting at the pressure or the actual issue with the lymphatic system. It won't improve. And I can't tell you how many women come into me and are like, it just isn't getting better with these strategies. And I wish that I could have gotten to them sooner because they're annoying to have to manage and they don't do a lot.
All right. So I want to get into, there's only a couple questions I wanted to ask that some women had. So let's see. One of the first ones was, how do you differentiate between neuropathy left over from chemo and lymphedema?
Very good. Very good. Okay. So one of the biggest differences will be that neuropathy is often bilateral. So neuropathy is often both sides of hands or feet. Depending on the treatments you've had, those symptoms can also be in the upper thighs or in the legs. So lymphedema will generally be unilateral on one side. So some women who have had nodes removed on both sides or have had a lot of treatment or impact to both sides, it is possible that you experience that swelling on either side, but it will be unique to that side, right? It will never be identical. If you experience that numbness and tingling at a baseline level and you're like, I feel like that might be related to the swelling, it will often be only on that side. So I would say the biggest difference of that is that it will occur on both sides.
Okay, good. The next question is, should I wear a compression garment while lifting weights post full axillary clearance? I think we kind of touched on that before.
Yeah. So my answer to this is yes. Anytime that you think that your system could get a little funky, as long as you don't have any negative impact from the compression garment, meaning you don't have numbness and tingling, swelling of a hand. The other thing to note here is I always love to recommend the use of a hand garment if you are someone who has had fluid that's surpassed the wrist, because fluid likes to follow the path of least resistance, right? It's just going to go where it can. And so if you don't have compression on a hand, especially if you've had swelling in that area or you've had funky feelings or cording, I recommend use of both of those things to be protective. But yes, anytime you think that anything could be problematic or swelly, put the garment on.
Better safe than sorry, right?
Right, yeah.
And then how long after having nodes removed can you develop lymphedema, and are you always at risk?
Good question. So anytime you have impact to the system, node removal, biopsy, lumpectomy, whatever it is, there is always a risk that swelling could develop and not get out of there as easily and maybe transition into a clinical lymphedema because the efficiency of that system is always affected. However, we believe that the further you get away from recovery of your treatments, the less likely it is that something like that would come up. But it is still possible. So that's why this education about self-awareness and understanding of how your body feels is important, because I don't ever want patients to worry about this because there is so many other things that your brain is processing. And it's important that we take down the fear factor of lymphedema because we can always manage it, right? And if it does come up, then what's more important is that you know who to get to and when, versus worrying, could it happen? Is it going to happen today? Like,
Right.
And the recommendation on it is so gray. There are some surgeons who say, you had 2 nodes removed, you don't need to worry about this, don't worry about it. Or there are some surgeons that take a lot out and patients had a lot of infection, or they had seromas, and then there's a little bit of a heightened surveillance on those patients. The truth is, if you're ever worried about it or you're not sure, get into a PT and have them do an evaluation for you so they can assess your risk and help you understand what that chance might be. So the answer is yes, there's always a risk, but the further we get away from those treatments and the more recovered you are, the less likely it is that something will occur.
Love that. Okay, good. The next one is, can weightlifting cause lymphedema, or is that a myth?
So, twofold. Myth. Unless, right? We go back to our rule here. I tell my patients, I will never, ever tell you that you can't do something. Never. But I will tell you. I will tell you that you need to follow your surgeon's recommendations because they go over anything that I say. But what I will tell you is I don't ever want patients pushing past the point of tolerance or symptoms that may resemble the lymphatic system getting overwhelmed, right?
Right.
So as long as you are weightlifting and you don't notice anything that is uncomfortable, full, heavy, tight, numb, anything like that, as long as that is not occurring while you are weightlifting or after you are done weightlifting, then no, it's not going to cause anything negative because you're in tolerance. However, if you start to notice a day or two later, it's less like a delayed onset muscle soreness and you have something a little bit funkier, then you might need to walk back that weight a little bit. But again, we have to kind of get away from this trope that we are telling women that they need to avoid every single thing, because like we talked about, weightlifting is helpful for the lymphatic system. Yeah. It just has to be in tolerance.
Wonderful. All right, I'm going to end it on this question, which I think is a good way to kind of sum it up, because it says, are there ways to prevent lymphedema? And I think that we already talked about this a little bit, but just to sum it up a little bit, I think in terms of preventing, I think what she means is like any ways to what are the best ways to combat getting lymphedema? So that would be movement, right?
And self-awareness of symptoms, understanding what your body feels like, how it's recovered, understanding the things that you might have experienced from the point of diagnosis, surgery, treatment, moving forward. Did you have infections? Did you have hematomas? Did you have to have things drained because fluid hung out in those regions? Do you have cording? Do you have limitation in movement? These are all things that I would love for patients not to have to figure out themselves, and getting into a PT and getting an evaluation right away so that they understand their own individual limitations with these things or lack thereof. But understanding how you tolerated your treatments, and if those things are getting better or they're getting worse, movement as quickly as you can, again, in tolerance and intentionally and safely. Use of a compression garment if you feel like things are swelling. But again, these are all things that you want to be guided by. And just kind of, again, being aware of how your body feels. I think one thing that I like to say about PT and breast cancer rehab, or at least the way that I run my program and care, is that the lymphatic system is just one system that is affected by cancer treatments, right? It's one system. We've got the vascular system, the neural system, the musculoskeletal system. We've got a million different systems that are being affected in very specific ways by very specific treatments. So when we only focus on one system, like the lymphatic system, we miss the boat a little bit on things that could not only improve the lymphatic system, but can improve your recovery long-term. So in physical therapy, when it comes to breast rehab, this type of care is focused on understanding how those systems all get affected and how might they intertwine with each other. So I think a long way of saying the answer to that question of preventative with lymphedema is understanding how those other systems might be affected and how they might continue to be affected for people.
Amazing. Thank you so much for that. Oh, actually, a question that I forgot that I had. So extreme temperatures, hot and cold, is that something that could trigger the swelling, or is that one of those dings to your lymphatic system?
So certainly I will say I don't have a ton of evidence about cold. However, one thing we want to be cautious about when it comes to thermal regulation or hot and cold extremes is we want to understand that sensation is always likely going to be affected in the area of where you've had treatment, surgery, radiation, chemotherapy. Those nerves are still working, but they are a little bit strange. So you may not always have the same understanding of how hot and cold feels. So when it comes to use of hot or cold physically on the skin, like an ice pack or a hot pack, you want to be a little careful about how that skin looks rather than how it feels. Because if there is something that's intolerable, you may not feel it, but you might see it, right? So extremes of temperature on the skin can cause the lymphatic system to have a problem because it's going to say, okay, something's up here. I'm going to swell to try to protect you. And we want to limit that. In terms of cold temperatures, there's not as much about cold temperatures, but warm temperatures for some women can increase the presence of swelling because, again, it's that lymphatic system being overwhelmed on a whole basis. And it just makes that system a little bit more stressed out, a little bit less efficient. So again, if we think about it from an efficiency perspective, if your body is having trouble with a hot temperature or maybe even a cold temperature, if your body is physically feeling stressed, the lymphatic system could be stressed. So in those moments, it's important to be just a little bit more careful about that. And again, the preventative strategies too, something to note. Again, we mentioned it, but being careful about needle sticks, injuries, things on that side. If you have a common finding that I have with women that get lymphedema kind of later down the line is that they might have an injury orthopedically and they are noticing swelling that's hanging around. And they're like, that's weird. Like I'm feeling better with my shoulder. The lymphatic system could be kind of wheeling and dealing in here. That's less likely now because we have such better conservative surgical treatments like the sentinel lymph node dissection and procedures that are conservative. We're very careful around the lymphatic system now surgically and in adjuvant treatments, but things to look out for.
So it goes back to kind of the self-awareness too. Just paying attention is probably the most important thing.
And knowing that what you experience is likely true, right? So I think something that we don't do, and I know you probably feel very similar to this, something that we don't do well in medicine, and I am always trying to make sure I do it better and better every time I see a patient, we are not listening very well. Patients will tell you exactly what is wrong with them. They will tell you every single thing that's going on. We miss it sometimes because we are focusing on larger things that maybe are not the main root of the problem. But I think what I can instill to patients is I want patients to feel empowered and autonomous in the strategies that we give them so that they feel more confident that what they are experiencing is real and that they should and want to get treatment with providers that they trust, and that keep telling people what you're feeling. Keep telling your providers what you're experiencing because it is likely going to give us a clue about how to help you the best. So trusting your instincts and what you feel is really important because that is the most important part of all of this.
Trust yourself and advocate for yourself for sure.
110%. And if you're with a provider that you feel like you're not communicating well with, it's okay to have a conversation about that or kind of switch to somebody where you feel like you're being heard because that is extremely important in women's care. And that's a big reason why this type of physical therapy is so important to me and why I felt so passionate about developing it. I want to exist as another part of your care team. We all talk to each other. People in oncology work as a team. We play very nice in the sandbox with each other. And you can't manage all of these things with one person, with your medical oncologist or with your breast surgeon. It's important that there is a separate space to manage things that are quality of life issues, that are physical issues, and sometimes tie into mental and emotional struggles too.
Absolutely.
So that's important to point out there.
Well, Devon, thank you so much. You are a wealth of knowledge, and I think this is going to help so many people. So I thank you, and thank you for answering all the questions.
Yeah.
And thank you for treating me too, because
yes, of course. Thank you for coming in and being an awesome patient.
It made such a difference for me though. So go see, that just is a trigger for people to go get help because the education alone, you're right, is so valuable. And I appreciate that greatly from you.
Yeah, absolutely. Anything. And again, if anybody has any questions or Lauren has my contact info, but certainly even if you just get in for an evaluation, either with me or someone like me, I know that it can be overwhelming to get to another appointment, but this type of PT is not the type of PT where you're going to be seen 3 times a week for 4 weeks and it's going to be super crazy frequent. We understand and we know that there is evidence behind seeing people more prospectively. And it might just be a visit or 2 to establish the relationship and education. Yeah. And then you have us there in your corner if you need us.
Amazing. Well, thank you again. It was such a pleasure to talk to you.
Of course.